Hello and welcome everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor defeater, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers to access the right treatment at the right time. Today's talk is important, but it is often an under-discussed topic. That is about chemotherapy-induced neutropenia. This is a common and potentially serious side effect of cancer treatment where the body's white blood cells, especially the neutrophils, they drop to dangerously low levels, making patients vulnerable to infections. Today, we'll understand why this happens, how it is managed, and what patients and caregivers should watch out for. We also aim to bust some myths and share practical tips. So, tag along with us. Without much further ado, let me begin by introducing our doctor to you. Dr. Krishnamani has been associated with AOI hospitals here in Hyderabad since the past decade. He is well versed in managing solid tumors, hematological malignancies, and also oncological emergencies. He has continually expanded his knowledge and skills by completing fellowships from prestigious international institutions. Throughout his career, he has been an integral part of various hospitals and organizations across India, earning recognition as one of the country's leading medical oncologists. He has served on the advisory board for clinical research. His commitment to advancing the field of oncology is further demonstrated by his membership in American and European oncology societies. Welcome to you, sir.
Hello, welcome to Cancer Reach, which is an initiative to spread awareness about cancer. So today, let's talk a bit on neutropenia, and you can probably even expand it to what is called febrile neutropenia.
So, sir, can you please help us understand the term neutropenia?
So, neutropenia means neutro means neutrophil, penia means it is less. So, low neutrophil count. That's all. So, neutrophil is a form of WBC. WBC is your white blood cell. So the white blood cell is required to fight infection. In that, the neutrophil is the most important cell to fight infection. So when you have low neutrophil or neutropenia, you don't have the ability to fight infection. So you get a lot of infections. That could be bacterial, that could be viral, that could be fungal. So neutropenia means low neutrophil count. Neutrophil is a part of the is a WBC which fights and protects your body against infections. So because you have a low WBC or a low neutrophil count, you are susceptible to infections. And what kinds of infections? Bacterial, fungal, viral, etc.
Sir, how does chemotherapy cause neutropenia?
See, chemotherapy is like a bomb. It will kill everything which comes in its way. It kills all the dividing cells. That could be, it kills the cancer cells and also all the dividing normal cells. That's why you lose hair, you lose taste buds, your RBC goes down, your hemoglobin goes down, your WBC goes down, neutrophil goes down, your infection rate increases, your platelet goes down, you have a risk of bleeding. So chemotherapy kills all dividing cells, and one of the cells which get destroyed during chemotherapy are WBCs. That's why you have a low WBC, low neutrophil count. And especially in the first 1 week to 10 days of chemotherapy, the risk of infection is very high because at that time there is a drastic fall in your body neutrophil count.
And how common is this condition among cancer patients?
Extremely common. Depends on the type of chemotherapy you give. So there are chemotherapies which have a high risk of neutropenia. So those kind of chemotherapies, it is extremely common. And if you don't give growth factors, I'll come to that later. Imagine you have given chemo, which you know will cause neutropenia, and for those patients, you have to prophylactically give growth factors. What is prophylactic? That is, after the chemo, after 24 hours, you give an injection so that it prevents the fall of the WBC. So when the WBC is actually falling on 7th, 8th day, this growth factor injection, which was given 1 week before, it lifts the WBC up. That is, prophylactic means a treatment given before you develop problems. If you don't give the prophylactic growth factor, the WBC count will fall, keep falling. It will not at all rise, or it will rise after a very long period of time. In that period, the patient has a lot of infection and risk of even death. So neutropenia is very common. Chemotherapy neutropenia is very common. You divide chemotherapy drugs based on the risk of neutropenia. The more drugs you add, you have 3 chemo drugs, higher chance of neutropenia. You have 1 drug, lesser chance of neutropenia. So the risk factors for neutropenia are the drug itself. Now, chemotherapy will cause neutropenia, but not a monoclonal antibody. So a breast cancer trastuzumab will not cause. Rituximab in lymphoma will not cause neutropenia. But an adriamycin will cause neutropenia, or a doxorubicin will cause. So the drug will be deciding. So what causes neutropenia? One, dictated by the drug, dictated by number of drugs, 2 or more drugs, higher risk of neutropenia, dictated by the age of the patient, elderly patient, higher risk of neutropenia, because in their body for the WBC to start producing again, it will take a longer time. How many prior chemos you have taken? So imagine a patient who has taken multiple chemotherapies before, his body doesn't have the reserve to produce WBC, or his bone marrow reserve, we say, is low. So somebody who has been exposed to a lot of chemotherapy, they have a higher risk of neutropenia. Elderly have a higher risk of neutropenia. Multiple chemotherapy drugs, higher risk. Individual drug will decide. And if you don't give growth factors for these kind of patients, higher risk of neutropenia. So these are all the risk factors. And lastly, if your bone marrow is involved by the cancer, there are only cancer cells sitting there. There are no normal cells. So those 1 or 2 normal WBCs also die because of your chemo. So bone marrow involvement has a higher risk of neutropenia.
So when you're saying the chemotherapy drugs, uh, what about when if you're giving the patient immunotherapy agents, will there still be neutropenia?
No, you don't see neutropenia that commonly in immunotherapy drugs. It is very, very common in chemotherapy drugs.
Okay. So what are like the common symptoms that patients or caregivers should watch out for?
So neutropenia means you will get infection. Infection means fever. So any high grade fever, or to put it very simple, even a single temperature of more than 101 degrees Fahrenheit, or 100.4 degrees if it lasts for 1 hour, that is fever. So if you have fever and you have a low WBC count or neutrophil count, you have febrile neutropenia. Definition of fever is 101, even one spike, or 100.4 for at least 1 hour. Now, that could be one symptom of neutropenia. Another symptom can be you may be extremely weak. Understand, cancer patients are already having low immunity. So they may not have fever all the time. So you may have very lot of weakness and fatigue. That could be a symptom. Somebody may have gut issues like loose motions. Somebody may have breathing issues because of infection in the lung. They may have breathlessness and cough and sputum. Okay. Somebody may have burning in the urine. Somebody may have mouth ulcers, mucositis, we say, or pain in the anal area. So symptoms could be, first foremost symptom is fever, weakness and fatigue is another symptom, mouth ulcers, anal ulcers, cough, breathing difficulty because it has spread because of infection in the lung. Urinary infections can present with burning urine, and gut issues can present with recurrent diarrhea. These are the common symptoms of neutropenia.
How long does one neutropenic episode last in a patient?
So the neutrophils fall down on the 7th day and they are low till the 14th day. Only when the 14th day it starts rising up. Okay. So I told you a lot of factors. One factor I forgot to mention is whether you have a hematological cancer or a solid cancer. If you have a breast cancer, your neutropenia will be less only for a few days, maybe 4 days, 5 days. If you have a blood cancer, what does it mean? Your blood is full of bad neutrophils, bad cells, blasts. Your neutrophils are few, so those will also die. The blasts have to get washed out. The neutrophils will also die. New neutrophils have to come. That will take a longer time. So neutrophil count or neutropenia lasts longer in those who are aged, who are frail, who are elderly, who have heart, lung, kidney issues, who have hematological cancers like leukemias, who have been heavily treated with previous chemotherapy drugs. So all these factors will increase your duration and risk of neutropenia.
So, what is the standard protocol when a patient develops neutropenia during chemotherapy? How do you manage it clinically?
So first is you have to prevent neutropenia. Let's talk about prevention. You have a chemotherapy drug which can cause a high risk of neutropenia, prophylactic growth factors. Prophylactic is a treatment given before neutropenia develops. That given injection so that WB doesn't fall at all, he doesn't get infection at all. When is it given? It is given 24 hours after your chemotherapy. It is called GCSF, granulocyte colony stimulating factor. So 24 hours after chemo, if you feel this chemotherapy regimen can cause neutropenia, you will give that growth factor injection. Artificially at the 10th or 12th day, it will make the WBC rise so that patient doesn't develop prolonged neutropenia and suffering. That is the first prevention. Once you develop neutropenia and if you are fine, see, if you do blood test on the 7th day for every cancer patient who receives chemo, his neutrophil will be low. That's not the point. Imagine you have given a breast cancer AC regimen, we say, that has a high risk of neutropenia, but you have also given the growth factor injection, the booster injection, we say. Then if the patient is fine, don't check the CBC on 7th day. If you check the blood count, WBC will be low. Patient is fine. Why do you want to check? Now you are fine. Are you checking your blood pressure while talking to me? No. So if the patient has fever, check. Don't say that, no, 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 I gave you GCSF injection, nothing to worry. No, no, no. Even despite GCSF, sometimes your counts may be low. You may need additional doses. So don't do blood tests if the patient is asymptomatic, has no symptoms. And uh, 7th day or 10th day, the neutrophil count will fall. And it will go up on its own if you give growth factors. If you don't give growth factors, it will be for a longer period. They come with fever and all that. So symptoms we have discussed. So how do you do? So this is an emergency. Febrile neutropenia is an emergency. In there, if the neutrophil is less than 500, that's a big risk. If the neutrophil is less than 100, that's a bigger risk. Normal neutrophil is between 1500 to 4000 or 1500 to 3000. So febrile neutropenia, that is fever and neutropenia, is a big risk. It's a medical emergency. The lower the neutrophil, the more sick the patient is. So if somebody comes with very low neutrophil count below 500 and fever, immediate admission, immediately starting him or her on IV antibiotics and taking their blood for culture to see which organism is growing. And obviously, you'll also add growth factor injections. But if the patient has febrile neutropenia, but neutrophil count is 1500 or 2000, patient is otherwise okay, stable, then you can put him on oral antibiotics. You don't need IV antibiotics. You need not admit in the hospital. You can treat him on an OPD basis. So what we should understand is febrile neutropenia is an emergency. Lower the neutrophil count, bigger the emergency. Admit the patient, start IV antibiotics, send cultures, and do all tests to see where your infection is. I told you the mouth can be infection, the anal can be an area of infection, the lung can be a source of infection. So do an X-ray or a CT scan. Gut can be a source. Abdomen, urinary bladder can be a source. So do a CT of the abdomen if required. So diagnose fever 100.4 for 1 hour or 101. Diagnose neutropenia, low neutrophil count. Diagnose that the patient has come with febrile neutropenia. How severe? Very low neutrophil count. Admit him. Start the process, IV antibiotics and blood cultures, and see for the source of neutropenia by scanning the patient. If the neutrophil counts are going up slowly, the patient is improving. If the fever is declining, the patient is improving. But if the fever is continuously increasing, the neutrophil counts are still very, very, very low. Patient's blood pressures are dropping. He goes into shock. New bodies, new parts of the new organs in the body are getting involved, like new patches in the lung. He's getting very breathless. He needs to be put on oxygen. He's not passing urine. The kidneys are getting damaged. His heart rate is very high. So all these are bad signs.
So in a patient who is not improving even after giving him the medicines to control the neutropenia, would you how would you manage the next cycle for the patient?
You start antibiotics thinking that every febrile neutropenia patient has bacterial infection. Within 3 days, if the patient is not improving, if the fevers are increasing and new complications like kidney and lung issues start, you escalate the antibiotics or start antifungal treatment. This is very common in hematological or blood cancers. We don't see it that commonly in solid cancers, but it is true. So you will escalate antibiotics, you will start antifungals, you will do scans like CT chest and CT abdomen to see what new things have propped up, what new infections have come. You will send repeat blood cultures, you will do an echo of the heart to see if there is anything sitting in the heart, some infection in the heart, which we call endocarditis. So you have to do all this. And this is the golden rule in febrile neutropenia is antibiotic has to be given in 1 hour. Otherwise, the chances of death are more than 30 to 50%. So that is very critical. So when you give chemotherapy to a patient who has a high risk of neutropenia, you will say, see boss, I've given you chemo. It can cause a high risk of neutropenia. I'm also giving you a growth factor injection prophylactically, preemptively as a prevention. But despite that, if you have fever, if you're having fatigue, if you're having chronic vomiting or diarrhea, not improving, breathless, come to the hospital immediately. If you're not eating, I will check your WBC. If it is very, very low, we have to admit you because it's a medical emergency.
So does neutropenia have any criteria for deciding the dose of the chemotherapy that you give to the patient?
That's a good question. See, you will know whether to change the dose only after an episode of neutropenia. Imagine there is a young lady, I have given the full dose. See, imagine a young lady, breast cancer, curable cancer, stage 2. What do you say? You have stage 2, curable cancer, young woman. I will give you the proper dose. I will not reduce the dose because you have to cure her. If you dose reduce, then you're compromising. Now, you give her the chemo, you give her the booster injection. You don't know she will develop neutropenia tomorrow. Your bad luck, she comes with a WBC of 0. Severe infection. She is in ICU. 10 days you have taken care. It is taken, despite the booster, it is taking 10 days for a young lady who is fit and fine. What does it mean? Her body is not able to take it. Other people are able to take the drug. An old woman can take it, but probably she is not taking. So next time, what will you say? Madam, you almost had death. You had such a bad time. We had to give you all kinds of higher antibiotics. 10 days it took, 12 days it took for us the neutrophil count to come up. So next chemo, I cannot give that dose because if I give that and God forbid it happens again, it's a big risk for you. So we will reduce your dose. So you will do dose reduction if somebody has had a very severe episode of febrile neutropenia necessitating ICU or prolonged hospital stay, etc. And in cancers which are not curable, I think you can go away with reduced dose. But in curable cancers, you should try as much as possible not to reduce the dose and give the standard dose. You have to weigh the risk versus benefit.
Okay. So, sir, now we'll go on to bursting a few myths. So, the first one is that neutropenia means that the cancer is definitely getting worse.
No, it has nothing to do with. Yeah. Um, if your cancer spreads to the bone marrow, it means your cancer is getting worse. That could be one of the causes of neutropenia, but that is not a very common cause of neutropenia. Neutropenia is more often treatment related rather than disease related.
Neutropenic patients should eat only boiled or bland food.
Eat, yeah, it is generally advised to them not to take raw food just like that and uh, bite off things. They are asked to also avoid pets and animals in their room, any flowers in their room. severely neutropenic patients, I mean, like blood cancer patients who are undergoing what we call induction chemotherapy, or blood cancer patients undergoing bone marrow transplant. Those kind of patients, we always give boiled food. They are not allowed to take fresh raw food and have pets and flowers in the room, etc., which is very common in the West actually.
Mhm. So the third one is that only visible signs of infection need medical attention.
No, there are a lot of subtle signs in your body, like terrible weakness, maybe because of low blood pressure, you're not eating anything. These are all things which are not visible, but it requires immediate attention. Yeah.
The fourth one is that if I feel fine, my neutrophil count must be okay.
There's nothing got to do with it, right? You can be fine, but in within 1 hour, if your neutrophil, actually, if your neutrophil count is low, you're fine now. But if it's really low and you have an infection, for that infection to overpower your body, it will take 1 to 2 hours or just in evening. So that is not the thing. Check your WBC count, check if you have fever, check with your doctor what chemotherapy you have taken, what is the risk of infection with that.
Okay. So the last one is that herbal or immune boosting supplements can definitely prevent neutropenia.
No, as far as my knowledge goes, no, I'm not an expert in herbal medicine, but neutropenia means you need to give growth factors to increase the WBC count, and you need to give antibiotics, antifungals, antivirals so that the patient doesn't develop infections.
Okay. So could you please enlighten us about the second opinion campaign which is being run by you?
So, as you all know, we have a second opinion campaign on Cancer Reach. It is to reach out to people. They can reach out to us on our WhatsApp message platform. Send in your reports. We'll try to answer them in a day or two. It's free of cost, and it's just a service that we are doing so that new patients who don't know what's happening, get a direction from us regarding how to access cancer care.
Thank you for this informative session, sir. And we hope to see you again next Friday with another interesting topic. Thank you for joining, sir.
Thank you so much.